Good afternoon, all. Uh, Welcome again to another informative session today, and thank you for joining. We all know that these are the challenging times for all of us. Still, you people are there and always supporting us. Today, there is a very important session, and we have already discussed several times prior at our platform. And recently, we did some story with India Today channel as well, in which they have covered that there are some researches going on internationally as far as cannabis and like the associated symptoms of this particular virus, that is COVID-19. So we have seen that in many cases it has been proven as an excellent remedy in terms of certain symptoms, certain issues, and in the researches also we have seen that cannabis is playing a very important role in terms of managing the cytokine storm, which is the primary factor of damaging further in terms of the organs, lungs, and other issues. So let's understand more about cannabis. Let's understand more about what kind of products we have in the bouquet. The company is Ananta Hempworks. They have recently started in this particular domain, and we are very much pleased and lucky to have them as our associate partners also. So, without wasting much time, the flow of this session will be we have Mr. Vikram Veer Singh, co founder from Ananta, and Sneha, she's heading the entire brand with Ananta Hempworks. She's managing the entire brand, and we have a very experienced medical professional with us, Dr. Swapnil. We welcome him on our platform. He is MD Medicine, and we will know about him more in the session today. So, we will be discussing about various aspects, and in between, me and Dr. Swapnil will be sharing some medical experiences, some case studies, or maybe some discussions about some products. I am personally using some products from Cannabis, so I would like to share my review and feedback as well in between the session. And already we are live on Facebook, YouTube, Twitch TV, and many other platforms. So wherever you are attending us and you are watching this session, you can post quickly your question or query whenever you want. And after the session, after the discussion, we will be happy to address and answer that query as well to you. Right. So without wasting much time, let me hand over the session to Mr. Vikram and Sneha for the further proceedings. Thank you.
Thank you, Dr. Saab. Once again, it's lovely to have we have on the back of this platform. This is the second time we are connecting with you, and today the aim of the webinar is for us to introduce our medicine Ayurvedic line to whoever is watching, and the aim is to connect to maximum doctors so we can supply more and more medicines and make the reach of this medicine wider. I completely agree with you that this medicine is helping a lot of people. And I watched the session of your India Today, which was very informative. And that is why we thought that we should conduct a session with both of you doctors who are already prescribing our medicines and also introduce the upcoming lines and the current medicine which we have right now. I would like to thank Dr. Swapnil for taking out the time for joining us on this platform, and welcome Sneha. I think we should take this
Thank
session
you.
forward and start by introduction of our product lines.
Mhm.
If you just change the slide,
Sure.
yes.
So we are at Ananta Hempworks, we are a hemp-based startup primarily focusing on nutrition and wellness. Today we are talking about our Cannabis line, which primarily focuses on pain management and pain relief for people who uh, face any kind of pain in old age, or athletes who face any kind of spasms or cramps in muscle pains. Or it's also helpful in anxiety management and control, or reduce in skin, good for skin as well, skin problems like excelsiors. So taking forward, we'll be introducing all our oral and contraceptive counter products that we've launched recently, and also we'll talking about what we are planning to launch in future. So taking forward, let's introduce our first product, which is the Canna Eve Pain Management Oil for oral consumption, which is available in peppermint flavor. Vikram should be talking about this further.
Yes, so this is our first oral line. Basically, our cannabis line is broadly divided into two categories, which is the oral consumption and topical, like Sneha said.
Mm-hmm.
So the oral consumption, this is the first formulation we have, which is the 10% strength of Vijay extract, and it comes in a peppermint flavor. And
Mm-hmm.
it has benefits of managing chronic pain, anxiety, reducing inflammation, and helping with conditions like insomnia. Dr. Saab, I would like to have your opinion because this is one of the first formulation we started selling on in the market. So I would like to have your opinion as you have already prescribed this. So
Right.
some advice and suggestions from you.
So definitely, I myself have used this product, and my patients have been using it too. It basically helps with patients who have chronic pain and have been using painkillers in the past, say
Yes.
for a long time, and that has caused a detrimental effect on their renal profile, kidney issues. So that's one reason people are like turning over to cannabis products for pain, because firstly it helps with your pain much comparatively much better than the conventional medicine. Secondly, it does not have any side effects. And
Mm-hmm.
also, I have observed with my practice, like patients who are going through a chronic pain ailment, they also have some anxiety issues. Some go into depression. Some have some mood disorders related to the pain. Also, insomnia is a big factor with chronic pain. So, cannabis actually helps with all these domains. Like it helps with pain, it helps with your mood disorder, it helps with your sleep. Whereas when we go with the conventional medicine, it usually causes insomnia. Moreover, it only helps with pain. It does not have any effects on other domains. So all in all, I would say using this oil helps with the patient, the mental condition as well, apart from his physical ailments.
Yes, I
And
Mm-hmm.
agree.
yeah, and the efficacy is pretty good. Like I have seen patients getting relief, within 2 to 3 hours after consumption. And if I would say for a long-term use, like say if the patient has used the medicine for 2 to 3 weeks, then usually he is almost like 70 to 80% already on his way to his cure for his pain.
Okay.
And
Doctor,
yeah,
we have a question here.
yeah.
Why prescription is important for these kind of medicines?
All right. So cannabis can be taken by all age groups, pediatric and
Mm-hmm.
geriatric age groups, but
Mm-hmm.
the weight is a concern here. So
Mm-hmm.
the doses usually range from anywhere between 20 milligrams to 40 milligrams, and it can extend up to 1,000 milligrams as well. So it depends upon the person's past medical history. If he has been on chemotherapy, if he has been on other pain medications, on opioids, so
Mm-hmm.
that also matters, because the threshold for phytocannabinoids, that is CBD and THC mainly, is
Mm-hmm.
different for is very subjective. It's different for every person. So a person can benefit with 20 milligram, the same other person can benefit from 60 milligrams. So that is
Okay.
something that the doctor has to take into consideration, and also his other concomitant medications that is going through, taking, like for example, maybe blood thinners or antihypertensives, or maybe
Mm-hmm.
antipsychotics. So in those cases, we need to tighten the dosage. That's why it's very
Okay.
important to have a prescription. Yeah.
Okay. So in the next is the same product in a different flavor, we can say, which is the natural flavor. We
Yeah.
have these available in three different size of bottles. Further, I'd like to ask you a question. Like we have two variants available in the mg section, which is the 5,330 mg, and one is 1,599 mg. So does it hamper any way, or is it based on some age factors or any particular elements or factors that we look forward to while prescribing the patient?
I think the question here, Dr. Saab, is that once we have different potency strengths, like the second product which we
Mm-hmm.
have is at 5% with your strength, and the other one is
Mhm.
at
Mm-hmm.
10%. So the mg which comes along with it,
Right.
how as a doctor do you decide to dose the patient according to the symptoms he's showing of whatever problem he has? So I think the question is
Right.
around.
Right.
Yeah.
So first of all, it depends upon the pain threshold,
Mm-hmm.
the scale of pain the patient is having, around 1 to
Mm-hmm.
10. If the patient is having a scale of more than 8 to 9, I would definitely go
Mm-hmm.
with a higher mg milligram dosage. But again,
Mm-hmm.
if the patient has never tried cannabis in any form before, especially medical
Mm-hmm.
cannabis, and
Mm-hmm.
if you are unaware about the threshold of the patient for for phytocannabinoids, that is when I usually start the patient on a low dosage and then tighten up the dosage accordingly. And
Okay.
also depends upon, yeah, if he's taking any other medications like antipsychotics or other pain medications, you know,
Mm-hmm.
which he is not. I mean, he can't leave them. Like he has to take them mandatorily. So in those cases, we usually start with a low dosage. And also, few patients they have a very low threshold for cannabinoids,
Mm-hmm.
so it's always better to start with the low dosage and then graduate up to higher dosage.
So it's
All right.
important to continue the medicine on regular basis for at least 2 to 3 weeks, right?
So yeah, so basically
Mm-hmm.
it's 2 to 3 weeks to show the complete
Result.
efficacy of cannabinoids. Yeah,
Mm-hmm.
but I would always suggest
Mm-hmm.
patients to take it for at least 2 months,
Okay.
anywhere
2 months.
around 2 months.
Okay.
Yeah.
Mm-hmm. Okay.
Okay. So
Next we
coming
have,
to,
yeah.
yeah,
Mm-hmm. Yeah,
Dr. Saab,
please
will you
take
change the
over.
slide?
Mm-hmm.
Yeah. Next, we have, this is our topical application product, which helps in reducing inflammation, elevates pain, eases arthritis, and lubricates joints. So this is only external application oil we have tried to offer our customers, and I would like to ask Dr. Piyush's advice on this because first, a topical application of hemp seed oil and the Vijay extract, how it is beneficial for the skin and how it is how it helps in inflammation. I think Dr. Piyush can suggest more on that. Dr. Saab, you're not audible. I'm sorry.
Yeah, sorry. Yeah,
Yeah.
sorry. So first of all, let me clarify here, as correctly mentioned by Dr. Swapnil, we need
Mhm.
to understand that as far as pain management is concerned, what exactly the options, already existing options we have.
Mhm.
As compared to the NSAIDs, as compared to the other morphine derivatives and other solutions we have in allopathic system of medicine, also in Ayurveda we have certain solutions, but the problem is with those solutions there are some side effects. In fact, in Ayurveda also we have seen with some medicines we use for pain management, there are some side effects in terms of gastritis, acidity, hyperacidity, and several other issues are there. Second, certain long-term usage also is not advisable due to some toxicity to some organs which has been there. However, on the same note, CBD oil and specifically that oral tincture based preparations are pretty safe to use. They are quite effective as well. And there are some other classical preparations also in Ayurveda, as far as tablets, churns, and other aspects are also there. They are also quite effective. However, we need to understand one thing whenever we are talking about medical cannabis, we need to understand one thing, that is the bioavailability. So, as far as the bioavailability is concerned, the vape form is the best form. However, the thing that is not right now that much available in India. The second form is the tincture form. So that this tincture, oral tincture, what we need to understand, that we need to put few drops under the tongue and then from there it will be absorbed sublingually. So for maybe few seconds we need to hold there, and then it will be absorbed and gradually it will give us the best result possible as far as the efficacy is concerned. And so that is the main thing which we need to understand. Otherwise, nicely explained by Dr. Swapnil about the various permutation and combination. And second thing which we need to understand is whenever we are prescribing to any patient, we need to understand that I think Sneha mentioned about the requirement of the prescription. So the requirement of the prescription comes in various scenarios. One is the dosage, because a layman can just open up the bottle and put randomly few drops under their trunk, but few drops here and there will cause some issues to them as well. So although on one side we are saying that it is one of the safest solution for pain management, however, there are some issues if not correctly being administered. If there is an incorrect dosage being administered to any person, it can cause several issues as well. So then the requirement of a medical trained registered doctor with a prescription comes in, that they will prescribe as per the body weight, age, indication. There are certain permutation and combination which we need to keep in mind whenever we are prescribing and deciding the dosage. So what exactly the potency, how much mg in how much ml is there in a bottle. So that will be the potency which we need to understand, and then to the patient what exactly his or her body weight, age, what exactly the indication, all these things we need to keep in mind, and then accordingly we can prescribe the dose. So that is the main thing which we need to understand. Now if we are talking about the local application, again we have seen that as far as the local application oils are concerned, like pain management oil or skin issues, very good results in terms of cannabis extract is concerned. And many patients were using certain other oils. There are so many oils, lots of oils are there in ayurveda, and many people are using ointments they are applying, and all these options are there. There are some NSAIDs agents also in terms of the local application. But if we compare with all of them, specifically this particular formulation or this particular ingredient, as a clinician, we have seen that uh, on one side is it is managing the pain, on another side it is also managing the inflammation, it is also improving the overall quality of life, the functionality of the particular maybe joint or whatever the area of concern they are applying, and it gives a long term effect as well. And on one side it is decreasing the pain, on other side it is also healing, so subcutaneously also it is getting absorbed, which we need to understand. So it's not only it is stopping the signal to the brain that pain is not there in my knee, which maximum pain management ointments or oils are doing. So it is
Correct.
doing that thing as well. However, on the same side, subcutaneous absorption of certain cannabinoids is also helping out at that particular area, that it is getting healed in terms of the inflammation, it is getting healed in terms of the other issues which are there. So the holistic approach is there in terms of the healing with these kind of products which we are using in our clinic. And again, congratulations for good quality. It is getting good results in the patient. So maybe Dr. Swapnil wants to add on something else to this local application aspect.
Yeah, sure. So
Yeah.
also wanted to mention add on to Dr. Piyush, which you rightly mentioned. So usually when we use other topicals like conventional medicines like diclofenac balm or Volini, which has basically diclofenac, which is an painkiller basically. So it does not work on the endorphins,
Yes.
the endocannabinoid system. Where the cannabinoids they activate your endorphins, which is a natural system in our body already present, which
Yeah.
helps to decrease pain. So what we are doing is we are just activating our natural endocannabinoid system, which is already present in our body. So that is not done by the conventional painkillers. So in terms of chronic pain, CBD does help much more, in the long run, without any side effects, of course. And also, I wanted to mention one thing like for oral consumption. A basic point is that many patients who are usually trying this medical oil for the first time, they are not sure about how many drops does you know, the dropper contain. So basically, I just want to tell them that the complete dropper is 20 drops. So 20 drops is equal to 1 ml. So so that
Okay.
they know how to titrate the dosage, and they can just divide the milligrams per bottle. For example, if it's 3000 milligram, so and it's a 30 ml bottle, you can just divide 3000 by 30. So
Yes.
that's basically, yeah. And then you can divide it by 20 drops. So you get milligram per drop, and that's how you can titrate the dosage. Yeah.
Okay.
Yes.
So
So
I have a question here for Dr. Swapnil here. Since we have two categories available, one is the topical one, and one is the oral one. So they are to be used in a combination, or they are supposed to be used individually, or this depends on some other factors as well.
So basically, what I have observed is in my clinical practice, combination always works much better, especially for pain, pain and inflammation. So
Mm-hmm.
patients with arthritis or if they have any inflammatory joint conditions, so I would always recommend using the topical application twice a day along with oral drops.
Okay.
Yeah, it helps. It works synergistically. Yeah.
Mhm.
All right, so we have shown you three of our products, and we have talked about the benefits and various applications and cannabis in general. We'd like to show you now our upcoming medical line, which actually we have tried to target to particular problems, so that our customers have more variety and there are more options, and they can particularly target a single problem. So I would like to introduce our line to that. Doctor, Saab, can you just take it up the slide? Yes. So this is. Yes, so this is our stress-free formulation. This comes with the Vijaya strength of 5%. It also has ashwagandha and peppermint, and it has hemp seed oil. So with this combination, and after a lot of research and speaking to a lot of doctors, we realized that this combination should work on stress particularly, though, and otherwise it also has multiple effects, but particularly we've targeted it to reduce stress. So it also immunes immunity, which comes as a with the hemp seed oil, and I can hand it over to Dr. Swapnil or Dr. Piyush actually, because we're using ashwagandha and all, you formulated this formulation to shed some more light on these targeted problems we are trying to handle. Dr. Saab, are you there?
Yes, so ashwagandha, as we all know, is an excellent herb, and it is having a like effect. It is having a very good effect in terms of managing stress, being an adaptogen and acting on certain aspects in terms of the stress, in terms of the anxiety. So ashwagandha has been researched worldwide exhaustively, one of the most researched herb in terms of, and I think there is no doubt in any scientific fraternity or any scientific platform. And this is one of the top, I will say, top three selling herb in US and Canada as far as overall herbal business is concerned. If you see, so this is along with turmeric and other herbs, ginseng. So ashwagandha is one of the top selling herbs. So I think we all should understand this potential of this herb, and it's an excellent combination because one side we have Vijaya and another side we have ashwagandha. So both will act synergistically, and it will manage the stress. And we have seen these days, due to this pandemic, due to this lockdown, due to this all these issues, many people are suffering several kind of stress, uh, professionally, personally, socially. Everywhere people are not connected much, so the stress is increasing. And as far as the chemical solutions are concerned, again they have their own side effects, and sometimes they are getting dependent or addicted to certain other aspects as well, which I, as a personally and professionally, as a medical professional, we discourage. In fact, sometimes people ask that being a Vijaya, being a like a herb that is cannabis, and it is also related to some kind of an addiction as well. So how you will justify? So medically, medically in a very less dose, it is beneficial. Again, let me clarify this point also on this particular slide, that comparing this to uh, an addiction of a particular herb is not at all justified, because all these products which we are talking about is are medically prepared with the due approvals from the authorities and regulatories. So the component which is responsible for addiction is almost minimum, at a very negligible level as far as these particular products are concerned, and it will give the therapeutic effect. It will give the efficacy will be there, but the aspect of addiction will not be there. So it will help in managing the stress. It will help people in calming down the anxiety levels. We have seen it has been a very challenging aspect, and these particular times are very challenging for all of us. So I think excellent products you have formulated, and hope that will give benefit to the entire population. And uh, right,
That's
so I
the
think
idea of the formulation, doctor.
yeah.
Moving to the next one, we can talk about the next one now.
And one more thing I want to add on to here,
Yes,
Vikram.
doctor.
Last year, IIT Delhi and IIT Delhi and I'm not remembering the name of that institute from Japan. They
Okay.
both have done some initial research on ashwagandha related to this COVID virus, and they have seen that ashwagandha is capable of blocking at a particular level as far as this viral replication is concerned, and that particular research is available in public domain as well. So
Great.
we need to do more research on this particular product, in which on one side we have Vijay and on one side we have ashwagandha. So apart from the stress, I think it will be a very good solution in terms of managing certain infections and certain other issues as well.
That was the idea, Doctor Sir. That is why we went with the combination of ashwagandha, and then we have hemp seed oil as a base carrier of it, which also has its own benefits. And that is why we thought that particularly it will target stress, but with all the other benefits of Vijaya and hemp seed oil, I hope we are able to deliver on this product. So, Doctor, we go to the next one. This is the pain-free combination which we have tried to derive. This is at a 12.5% Vijaya strength. And why we have increased it is because this assists in chronic pain. It helps in migraine and improves sleep. I think you will agree on this factor that this combination with Vijaya has primary effect on chronic pain. That is what we have tried to achieve with this medicine. Uh, we can go to the next one. Yeah, this is Sleep Well. This is the combination we are trying to achieve with strawberry flavor, Vijaya leaf, and hemp seed oil. And this we have targeted, and we expect the customers to use in the night who have a problem with insomnia or sleep disorder, or who are not able to complete their sleep. This is at a 5% strength of Vijaya extract, and the base carrier is hemp seed oil in it. And strawberry, we just thought would be a good flavor to add. This is going back. This is a topical application we have formulated. This is we call the Skin Protect, which is Vijaya leaf extract, but the base carrier is coconut oil. It is virgin coconut oil. So we thought that because a topical application oil, so we already have a hemp seed oil variation. We'll take out a coconut oil variation, which has its known benefits for the skin. So that is the idea behind this product. Then after this, we are coming out with these capsules. This is going to be a 30 capsule box, and each capsule is strength at 25 mg of cannabinoids per capsule. So the idea was that people who have a problem with the oral consumption way, or dosing is a problem. So this has targeted 25 mg, so and it can be taken orally. The idea behind this variation is so the patient is able to choose between the oral consumption in form of capsule or in form of the oral tincture, and that is why we have so many products which are basically targeted, targeted towards pain and anxiety and sleep management, basically. So that is what we have in the upcoming line. And the last product which we have tried to formulate is the hemp balm. Now, this bottle of 25 grams has 400 mgs of cannabinoids. And this has other components like menthol, jojoba oil, citronel oil, peppermint oil, cocoa butter, and everything. This we have targeted people who want to use a balm, and especially it helps in minor pains, headaches, sprain, muscle recovery, and it provides also relief from cough and cold. We have tried to include ingredients like that in this balm, and we hope that it has a good pain management delivery to the patient. So these are the upcoming products which we have, which are going to be available within the next 30-40 days on our platforms. And Dr. Saab, I hope that these products we are able to deliver the desired result. Um, but to Sneha, do you have any other questions?
Yes, I have a question. So
Yeah.
since we have these oral, oils for consumption for pain relief and management. So what is the, proper way of consuming these? Is it just the 2 drops as prescribed by the doctors, or they can be added to any food items like green tea or coffee for by the patients to have?
Yeah, so definitely they can add it to their food as well. And I would basically recommend adding it to, some kind of fatty food because lipids actually help with the absorption of cannabinoids. It's a lipid soluble compound. So yeah, so it's better if you have it with you can have it with your dairy, you can have it with your yogurt, or you can just have it on a piece of bread or a cracker. Uh, with my experience, I would say that when you add it to your tea or coffee, what happens is it tends to stick to the surface of the vessel,
Mhm.
You'll
the
end up
container.
losing some.
So that's where you kind of lose a drop or two. Yeah. So just keep that in mind, I would say.
Mhm. Okay.
Dr. Saab, Dr. Piyush, would you like to add anything?
Yeah,
And
so absolutely, as Dr. Swapnil mentioned, and definitely it can be taken with any food. However, again, we request when we are seeking for the maximum efficacy, so the sublingual absorption is the best one. However, if patients have issue in terms of the flavor, in terms of the taste, or any other issue in
Mhm.
terms of getting absorbed from the sublingual surface under the tongue, then
Mhm.
they can mix it with any food or drink they want, and that is one thing. Second is already I think two or three products are there, but some products are in pipeline. So we need to understand when the remaining products will be launched. Some doctors are already asking the details. So I request all the doctors and all the audience who are right now attending this, you can let us know your contact details. Our email ID is flashing on the screen. So you can let us know. You can mail us. You can post your details in the comment section also. We will ask the company person to be in touch with you and provide you the entire details about the uh, catalog, about the product information. There are some special offers and schemes as well for medical professionals. So that will be discussed with you one to one by the company person. So maybe you can drop on your details and let us know. So Vikram, when you people are planning to launch or maybe other products which you have mentioned on your presentation will be available, because I think as per my understanding only the first product, that is the pain one and the local application, that is only available. Other
so I'll
products will
just
not.
reconfirm this, Dr. Saab. So we have three formulations available in six different SKUs currently, which are already with us, and we are already supplying them. And the other products which I've shown you, which are about eight other products, which are in our upcoming line, will be available hopefully between the next 30 to 40 days. This lockdown has actually delayed a couple of things. We should have already procured these products by now, but we are hopefully getting them in the next 30 to 40 days. So the upcoming line should be available in maximum that time frame.
Great, great. And Dr. Swapnil, in fact, I need to discuss one
And
aspect
all
with
these, sorry, one more thing is all these details are also available on our website in complete format. So if anybody logs on to the website, which is hempworks.in, www.hempworks.in, they can look into the individual product and get all the details. It's mentioned every there completely with all details.
Great, great. Fine. So, Dr. Swapnil, I want to take up one in fact question with you, as I know that you are also into pharmacovigilance and you are from that background as well. So, what exactly, as most of our listeners are doctors, practicing doctors and clinicians, so what you recommend and what you basically see in your day-to-day practice and in your professional experience, that the question is specifically what kind of aspects a clinician should take care while prescribing cannabis products or Vijaya products, and what kind of maybe issues or maybe triggers they need to document as far as the patients are concerned, or what precautions they should recommend to the patient. So these aspects maybe you can just clarify a little bit to all our audience.
Sure. So basically, in my practice, I have seen that cannabis does not react with most of the conventional medicine, but there are few exceptions. For example, antihypertensives, especially amlodipine. I've seen patients taking amlodipine, old patients, geriatric patients who are on amlodipine or antihypertensive drugs. They tend to experience palpitations sometimes. That is due to the mild hypertension caused by effect of both THC and amlodipine. So there is a drop in blood pressure, and patient experiences a bit of palpitations. That is one thing. Another is some patients who have a very low threshold for cannabinoids may experience tingling in their arms, in their fingers, in their feet, and they might also feel a bit dizzy. Dizziness is quite prevalent in those patients. Apart from this, I have seen two patients with allergic reaction to cannabis, where They had breathlessness, breathing problem, and coughing. So I would advise, like, in these are very mild. Like in 2 years of cannabis, 2 3 years of cannabis practice, I have only seen two patients having this kind of symptoms. So usually these patients are recommended not to take cannabis because they're allergic to it. So it's better avoided in this kind of patients because it can lead to severe anaphylaxis if not if not taken care of. Yeah.
Right. Also, we have seen in our practice, and we have cautioned whenever people are taking cannabis or Vijaya medicines and products to have some gap while like whenever they are taking alcohol or any liquor, because we have seen some issues with some patients. And there are some studies also that simultaneously it is not suggestive to have cannabis and liquor as well. Any experience you have, or maybe it's anything you want to advise?
So yeah, so it is advisable not to take it with alcohol, any kind of cannabis, medical or recreational. I have one patient who had used these cannapain capsules, or I would say high THC capsules with liquor, and that's when he again had palpitations and he had vivid dreams, when he was sleeping, and he was very dizzy the next morning. But that's about it. That's what he experienced. But then again, it also depends upon the amount of cannabis the patient has taken, medical cannabis, and the amount of alcohol he or she has taken. And I would also mention that it's always better to keep at least 4 to 5 hours of gap between your other medications like antihypertensives, antipsychotics, and antidepressant medications, and cannabis. So maintain this gap of 4 hours, and I think that is good to go. And patient won't have any side effects.
I
Right.
think this is where doctors have the doctor-patient relationship and understanding the dosage and understanding the need is very important. And I think you were also stressing on the same fact that we have to understand the patient's need, and according to that only the doses
Yeah,
can be prepared. It is not something which can be generically taken or in anybody's advice. So the correct advice with correct information and correct problem is very important for even for a doctor to prescribe to a patient. I think that's the main point over here, and to understand the patient's need basically.
Right, great. So I think we have tried to cover certain aspects today, and it was a very good session. And in fact, thank you, Vikram and Sneha, for presenting the entire range. We are looking
No,
forward to have such nice, good quality products and medicines for our patients. And once again, thank you, Dr. Swapnil, for putting time on your busy schedule, sharing your valuable inputs and experience you have. There are very few physicians and physicians in India right now, and you are one of them. So we are very much privileged to have associated with you, and looking forward to maybe many more sessions with you. We can have some exclusive sessions in which we can talk upon various aspects of medical cannabis practice. So today it was just an introductory and a brief talk, and maybe a introductory launch for you as well on our platform. But we will be requesting you to give more time to us, and let's have some detailed, exhaustive information and a session from your end, so that all our associated clinicians and practicing doctors will be beneficial, and accordingly we can take it forward. So I request,
sure.
many doctors are posting their comments, but unless or until you will not share your email ID or contact number, the company will not be able to connect with you. They will be very happy to give you some samples also, as I can see some requests are there. So they are very much supportive, and they are looking forward to encourage medical cannabis practice in India. So I know them, and I think that they don't have any issue in providing samples as well. So don't worry about that. But let's take it forward in an ethical way. Let's proceed and spread this particular. Uh, I will say, I will not add these kind of words. like wonder or magic, but yes, it acts like that. And everything is based upon science, everything is based upon logic, and everything is related to the specific mechanisms in which this particular herb is working in our body. So let's take it forward in terms of medical cannabis practice in India, and we are looking forward to have all of you educated, and let's collectively ensure that each and every person will get healed without any side effects, without any harm. So thank you so much again to all the panelists for joining
Thank
me
you,
today,
doctor.
and we are looking forward to have many more sessions with all of you. Thank you.
Really, thank
Thank
you,
you,
Dr.
thank you,
Piyush, for joining us today on this platform. And thank you, Dr. Swapnil, and thanks, Neha. We should
Thank
connect
you.
again soon.
Sure.
And although to all the viewers also, if anybody wants to connect, please, Dr. Piyush, you can share my number, and I would be happy to connect with anybody and provide any information.
Sure. Thank you.
Thanks a
Thank
lot,
you.
guys. Thanks for
Thank you.
joining.